tongue tie releases have a reputation, especially with social media, as being a quick procedure, and the procedure itself is, but at this office what we do is we put our patients through a program, and the reason why is that over time we found out that patients who take a quote-unquote shortcut with just the procedure itself often have higher rates of complications and compromised outcomes, and we don't want that for anybody. And so by having patients go through a program where we do physical therapies known as myofunctional therapy, sometimes we use the laser, a whole host of things to really help the patient prepare and understand and get ready for the surgery, make sure that they get the most range of motion and function afterwards, and that is really what makes our practice awesome. Some basic things that I ask our myofunctional therapists are for things like holding a cave for at least 2 minutes, and the reason why is during the procedure, the way we do our releases is the patient is awake. And holding a cave for a few seconds at a time throughout the procedure for me to assess how much release they need further, or if it's time to wrap things up, is really helpful. On top of strength, we also look for flexibility. If patients are compensating into what they think is an end goal or outcome, that's not what we want either. So I think that ultimately is really what we're looking for ideal outcomes. Ideally, patients should get to know myself and my assistant and be comfortable with us in our room, our chair, the noises from the machines that we use, the equipment that we use in our room. So I generally like to meet patients at least twice before the procedure. You know, for our older patients that may not be necessary, but I find that especially for our younger, smaller patients, it really is helpful in building rapport. I think patients really ought to be focused on understanding that we really want what's best for them, and that's really important when I, as your surgeon, am expected to make incisions that are sub-millimeter accuracy, because I really want the best for you. So to have that kind of accuracy, we need our littles to be really, really still, you know, and sometimes that's not possible depending on how young a child is. And so we assess maturity, behavior, ability to listen to instructions before, during, and after the procedure. If a child's not ready, that's okay. I think sometimes having expectations and goals are good, but it's okay if the goalposts shift. These children are developing and growing, so we'll reassess. Sometimes I might recommend 1 or 2 more laser sessions if I believe it's a matter of building trust and ease with myself and my assistant. If I believe it truly is the child is not psychologically ready, we reassess in a few months, and that is okay, because typically most of our patients are undergoing therapy for other issues within the office, so we monitor them and then we try again. It is okay to try again later.